Doug, one other chapter you wrote in the book was about the what you do in the first 90 days. So once you are that chief medical officer, you've gotten to that position. How does one approach the first 90 days to set yourself up for success?
Yeah, thanks, Rex. I think those first 90 days or first couple of months are really critical. You'll never get this opportunity, those first 90 days. People don't know you yet. Expectations are on the lower side. So you can ask all sorts of dumb questions, and people may not think much of it. And you need to take advantage of that. And you need to visit everywhere. You need to explore. You need to ask people what they're proud of, where they think the problems are. So spend a lot of time in that first 90 days really asking all those questions because you may not get another chance. Later on, they'll expect you that, oh, you must know this or you should know this. But you're early on, so people are going to give you some grace. It's also, the time when you can make your first impressions for physician, nursing leaders that don't know you. So be prepared for that. I always tell my CMOs, when you start visiting with folks, come prepared, know their work, have looked at their bios or their LinkedIn profiles before you sit down and, meeting with some of the stakeholders. That'll give you a lot of mileage if they know that you did your homework ahead of time. Those first 90 days, you got to meet with all your stakeholders. So, that's your hospital CEO, the medical staff leadership, the MEC, the CNO, probably the board chair, those sorts of folks. Then you need to make the rounds with what will become your team, your quality improvement leader, your medical staff office leader, your medical directors, department chairs. Seek out the medical staff attorney. Most hospitals have an attorney. And I can't tell you how many times that's really saved me to have a good relationship and be able to pick up the phone and I'm dealing with this situation. What do I need to think about? So find that individual, develop that relationship. And I think, that's the time, those first 90 days where you want to understand the organization's current performance. Maybe you've done this during the interview process, but if you haven't, what's their current quality performance? What's their current financial performance, their accreditation status? You need to have all those facts and figures really at your fingertips as you start into this job. And then it's just kind of walking the halls. And Mark mentioned this as well. This is your opportunity to go to the different parts of the hospital that you haven't frequented. I'm an internist. I got to put on scrubs and go in and watch folks in the OR. And I don't get to do that very often since medical school. So take advantage of being able to really visit the whole hospital and ask questions of everybody, not just the physicians, the line nurses, the maintenance people, your environmental health workers. I mean, everybody's got a story to tell about what they think the hospital does well and where they think there's gaps. So that's your first 90 days. Because I think as you step into that first 90 days, there'll be a lot of pressure to create an improvement plan. People say, well, what are you going to do? What are you going to focus? And I would suggest to CMOs, you really try and resist that. Don't overcommit in that first month or two. Tell people that, hey, I'm doing the rounds, I'm doing my homework. And if you can convince people that your job in those first 90 days is to come up with the plan, you'll talk about the plan in a couple of months. After you've done all your homework, you're in a much better position. And that way you haven't overcommitted because you don't really know where all the potholes are and where the work is until you've really sort of done all that investigation. So do resist that pressure to say, here's my plan, 7 days into the job. It's not fair to do that, but there'll be pressure on folks to do that.